a community health center perspective, and I think about the panel earlier, patient engagement, community engagement, and the care that people receive, and ensuring their safety within the places they go to get care. Health center boards are over 50% consumers. So I remind people there's no other model like that. And many of us in this room serve on boards. Imagine if 50% or more of the people who sit around the table could say, I don't like how clean the waiting room is, or they didn't speak my language when I walked in the door, or I don't think my provider is culturally competent and doesn't believe that pain in my side is real, or I think there's some error in the prescribing that I receive. So one is we have consumer boards that have a seat at the table to engage in that way and drive the policy of our organizations.
Every year, when you look at your mission, vision, and values, quality and patient safety has to be a core value. You got to write it down. They have to vote on it. You have to include it in your mission statement. You have to include it in where you're aspirationally moving as an organization. And then you have to tie measurable things to it. Every year we have a strategic action plan with a whole section devoted on quality and patient safety. And when all else fails, tie everyone's compensation to it, right? So, that does really help.
Even though we want to be successful, we will fail. And the leadership and culture around responding to failure, I think, is important, and how that's done at the local level, within the office, how that's done at a bigger systems level as well. Again, the not one-size-fits-all approach is going to be important, especially as we look at integrating this into private practices that may have workforce challenges, is how do they integrate this seamlessly into their DNA, and it's not viewed as additive, but it's really viewed as integrative, and it's part of what we do every day taking care of patients.